Welcome to Stop Hiding, Start Healing, the podcast where we dive deep into the transformative journey of self-discovery and healing from addiction and other life struggles with your host, Craig Brown, author, speaker, and recovery pastor. Craig and his guests will guide you through conversations that empower, inspire, and illuminate the path towards a more authentic and fulfilling life. Together, we'll explore stories of triumph over adversity, expert insights on personal growth, and practical strategies to help you break free from the pain of the past through Christ-centered recovery. It's time to let go of fear, embrace vulnerability, and embark on a remarkable voyage of healing. Join us as we uncover the wisdom that emerges when we choose to stop hiding and start healing. Now, here is your host, Craig Brown.
Welcome to Stop Hiding, Start Healing. I'm your host, Craig Brown, and I am absolutely thrilled to have one of my favorite people as a guest today. Dr. Umhau and I met about 28 years ago at church, matter of fact. And we have been friends ever since, and both of us have been on parallel paths helping people be set free from alcohol use disorder, myself helping people with all kinds of different addictions. But John is a great man of God, dear friend, and I'm just so grateful that you decided to join me on my podcast. So I want to give you a welcome.
Well, thanks, Craig. I think it's great that you're doing this. A lot of people need to hear the good news that they can be healed from addiction.
Yeah, absolutely. And that's really the focus and the theme of this podcast is being set free. Stop hiding it and be on the path to start healing it. But before we get any further, I have to read your bio. And by the time I'm finished with this bio, we may have like a few minutes left. So I'll speed read. But it's very important because our audience needs to know the depth of your experience in addiction medicine and public health and everything you've been investing your life in for the last, 40 years or so. But let me read this. Dr. Umhau established private medical practice devoted entirely to the treatment of alcohol use disorder. His website, and I encourage everybody, those of you that have a family member or those of you that are struggling yourself, to go to his website, alcoholrecoverymedicine.com, alcoholrecoverymedicine.com. Dr. Umhau has given numbers of keynote lectures on the treatment of alcoholism and is considered a leader in this field. As a United States Public Health Service officer, he served with the FDA in the Division of Psychiatric Products and with the National Institute on Alcohol Abuse and Alcoholism as a senior clinical investigator. He has authored numerous papers on alcoholism, specifically in the area of drug development and imagining the effects, medications, and on alcohol. Dr. Umhau has a special interest in the effect of diet on neuroinflammation and psychopathology. And we're going to be talking a lot about diet, nutrition, addiction medicine, and the brain, etc. He earned a bachelor's of science degree at Davidson College, a medical degree at Wake Forest University, and a master's in public health at Johns Hopkins University, and is a certified physician executive. He completed a residency in clinical preventive medicine at Johns Hopkins University and is board certified in both addiction medicine and preventive medicine. Now, it's worth mentioning, you and I both, I've been involved, of course, as you know, in Christ-centered recovery for the last 27 years. But I'm a big fan on faith and science, the combination of faith and science when it comes to treating people that struggle with all addictions, but specifically we're going to really drill down on alcohol use disorder and your experience in treating many people, thousands of people over the years. So it's just want to make it clear that you and I are totally equally yoked on Christ-centered recovery and how that restores the soul, the mind, the heart, behaviors, setting free, changing lives, but also the medical, the addiction medicines when it comes to alcohol use disorder. And I'm a firm believer that God worked through, gifted individuals to create medications to heal the brain that he created, right? To get them to the place where their brain can begin to heal by taking, and we'll talk about naltrexone and other medications, to at least get them to the place where they are relieved from their false reality, right? That they've, developed in their brain, to a faith-based, Christ-centered reality to heal that brain, to allow them to get to the place where they admit they have an issue, they're ready to do whatever it takes to get well and to be set free with a combination of Christ-centered support and also science, which is a great combination of what you and I have been essentially talking about and collaborating on since we've known each other,
Yes, it's alcoholism is a complicated problem. It really requires complete understanding of an individual, and of course the spiritual components that people bring can be very, very important in healing. There's a lot to be learned about the biochemistry and the neurochemistry and the anatomy of the addictive process. And there's also a lot to be appreciated for things we don't quite understand about our personalities and our faith and so forth. And I've seen many people develop freedom from alcohol use disorder in different ways. So there's a tendency for people to say, if I got sober and free from alcohol in this way, then everybody needs to get free that way. And that's not the case. People are different. Some people just respond to one thing and others. I've seen people get better simply by taking the naltrexone or other medications. I've seen people get better simple by improving their diet. And I've seen people get better by having a deeper faith. And that seems to be the way that it is. Each of us is different. Some people need counseling. They have terrible things happen to them that lead them to alcohol. Some people have genetic issues that make alcohol taste so much better. And some people find that their desire to drink is increased by the medications that some well-meaning physician might give them, not being aware that those medications can increase the risk for developing addiction. So it's an extremely complicated situation. And, of course, it's all driven by your society. If you're in a society that doesn't even have alcohol, it's not an issue for you. But if you're living in a family or a society where alcohol drinking is common, becoming addicted to alcohol is more of an issue. And our issue, I think, Greg, is we want people to get free so they can live the best life that they were intended to live. That seems to be the way that gives people most understanding of this problem is that somebody can choose to drink alcohol. It's not wrong to drink, but we just don't want anybody to be a slave to some addiction, and that includes alcohol.
Right. Absolutely. Now, let's back up a little bit, because what I want to find out, and I'm sure our audience would love to know, what drove you just in your past, all your experience, education. What was it? What was that defining moment or in your past that guided you on that? I'm not going to say myopic, because you're not just drilling down on one particular thing, but alcoholism. What was it that drove you to be so passionate about helping people be set free from alcohol?
Well, that's really interesting. I don't exactly know there's any one aha moment, but there are a lot of things that kind of led me to that direction. When I was in college, I was really interested in using my time to really make a difference. And a lot of people in my college were of that generation where we really wanted to improve the world. And so being a public health doctor seemed a very ethically pleasing thing to do. And so I
Yeah.
ended up in a situation where I could get training in preventive medicine, keeping people healthy. And I did a clinical preventive medicine residency, which was designed to help people stay healthy instead of just fixing a disease or a problem that once it developed. When I was
Yeah.
at Johns Hopkins, I had to go to an Alcoholics Anonymous meeting every week as part of my training. And I sat in these meetings and you could hear people tell stories. I could see folks that had been really changed by this terrible addiction and they'd gotten free through Alcoholics Anonymous, through the 12 steps, and seeing how
Mm-hmm.
these men and women helped one another. They were humble.
Mm-hmm.
They were trying to make themselves the best people that they could, and they realized they had a condition that they had to continue to be aware of and fight. And I really saw these men and women had a deep character development. I really respected them, and I
Mm-hmm.
continue to respect people that have this problem and want to do something about it because they struggle and they're successful sometimes. Sometimes they're not. But I wanted to be a part of their story and to be their coach and to help them through this. And um, as time went on, I spent time working with homeless men and women in Baltimore and DC, and I could see that these men and women were really suffering, and there was not a whole lot that could be done to help them at the time when I started. We had a medicine called disulfiram, which would make them sick if they drank after they took it. And it worked a
Mm-hmm.
little bit, but a lot of times people would just want to drink so much that they would drink even if they took it. And I had an interest in just understanding more of this problem. And so I ended up taking a job working with the National Institute on Alcoholism and Alcohol Abuse at the NIH. And it was a fabulous opportunity to learn. Maybe I could make a contribution in the research to help people overcome addiction.
Mm-hmm.
And the experience of talking to homeless guys that really were so excited about the fact that I wanted to learn how to help people like them. And so that's sort of been a
Yeah.
real driving passion for me. And of course, I've been interested in the science, and I love learning about the human body. And it's a wonderful machine. But if we don't know how to use it right, then we suffer the consequences.
Absolutely. Absolutely. Yeah. And well, I really respect the fact that you were helping. You have a real heart. Just knowing you as my friend for all these years, a true passion and a genuine interest in seeing people be set free. I know that for a fact. And I don't know if we could say that about every physician around the world, but we're not talking about them. We're talking about you and all that you've done and the impact you've had on so many different people. In my experience, I'm in the place where you would send people. You referred so many people to our ministry at Church of the Redeemer. And in that environment, and just over all my experience, observations, but also my personal experience, having come from the pit of darkness of addiction myself, I'm convinced it's shame, pain, trauma, abuse, and other very, very hurtful situations that people have been in their life where they turn to alcohol, other addictions to hide that shame and pain and hurt. I mean, I'm convinced of it. So that's why, you're on the science, on the medical end and the helping them. And the other part is so many people in the church frown on, and having science enter in. And the church should be at the forefront of helping people at the pain level, being more intentional at the pain and shame level, and helping people, as David in Psalm 23, and restore my soul, Lord. And that's the role that you and I are both in, and we're on a kind of we're equally yoked in a parallel approach to doing just that. Now, let's talk about the brain. And I know we could take about a half a day doing this, but we'll spend a good amount of time because I've had you speak at the ministry, before, and sharing about the brain and addiction, and specifically the brain and alcohol. And this is a beautiful brain that God created in every single one of us. And it's so complicated and so amazing. But what does alcohol do to it? What does alcohol do to the brain, and how do the medications help in healing the brain?
Well, that's a big question, Craig. The thing about alcoholism is it's really very unique for some people. Some people get into alcohol one way, other people get it a different way. And in my experience, there's no blanket way of saying this is why people drink.
Yeah.
Some people have a marvelous experience the very first time they drink, and they love it.
Yeah.
I had one fellow that I knew that had a family history of alcohol, and he drank once. After that one time, he knew he had alcoholism, and he went to AA meetings. He knew that
one time
he knew that he had a problem. So, the shame and the pain that you described may not be his story. Other people, they don't have that.
So past experience, growing up with an alcoholic father, or a mom that struggles with alcohol or what have you. So experience, genetics, other things can lead people. I believe, and you may have experienced this at Wake Forest, but people want to fit in. People want to fit in. Think about it. At a very young age in high school, you want to fit in with that group, and that group is at keg parties and doing all these different things. That's how I got led into it. Sure. I was in a party down at Bethesda, my first time drinking. I was so sick. I was so sick. You thought, you think you would learn your lesson. A friend of mine had to carry me home and carry me to my room, and it was just disgusting, absolutely disgusting. And you would think, no, I'm never going to do that again. And I told myself, I'll never do that again. And of course, many years later, after being, using drugs and drinking, I find, but as I share in my book, the first chapter, I changed when the pain was greater than my fear. When the pain was greater than my fear of changing and getting well and being set free. And you've experienced that too with so many different people that you have helped.
Yeah, it's really, it's so different for different people, Craig. But about the genetics of it, like you describe an experience like that, we have medical reports and research that shows that when someone has a first drink of alcohol, if they're predisposed to alcoholism, they'll have a completely different experience than people that don't have those genetics. So we can predict pretty well, to some extent, that someone has a risk for alcohol the very first time they have something to drink. And people don't recognize that this is a problem. And after a while, everybody thinks they should be able to control themselves and to have mental abilities to overcome an addiction. But that's the point, is you can't. And people feel the shame that they can't quite do that. Some people experience that more than others, but it's a real issue. People need to recognize and to be able to see that they need a special attention to alcohol. Some people can just say, okay, I'll stop, and they have the willpower to do it. Other people, they're carried along by their social situations or their pain or their depression, physical, mental pain. And part of that, is based on the biology of the brain, whether it's the genetics or oftentimes it's nutrition. I find that the nutritional aspects of our life are extremely important for our brain. It's a very sensitive organ in terms of suffering dysfunction if we don't eat well. If we eat, in my case, my research was to look at the omega-3 fatty acids that we get in fish oil in the brain. When I was at NIH, that's what I researched. And it turns out that people that are heavy drinkers, when they stop drinking, their brain is basically requiring more and more of this omega-3s to replenish the omega-3 in their brain that's probably been lost when they are heavy drinkers. But omega-3s in the brain, that's what the brain cells are made of. And without the components of the brain, whether it's a vitamin or minerals or omega-3 fatty acids, the brain can't restore itself when it's damaged from alcohol and the problems associated with other mental illnesses. And without the proper brain structure and function, it's very hard for our willpower to be effective. And so sometimes people have plenty of willpower. It's just that the brain can't put that willpower into action without
Sorry to interrupt you. Let me share the screen because I have that graphic that you have shared of the brain. This is the graphic that you've used, and this is when you came to share. Explain this and how the effect of alcohol in the brain versus a healthy
So what
brain.
we're seeing the images of a brain done with a CT scan and MRI. I think this is showing the atrophy of the brain that occurs with alcoholism. And you can see on this is the right-hand side, the individual with more dark spaces. That's empty space compared to the brain on the other side, which shows it's full of the light-colored brain. This is very commonly seen in people that drink heavy. The atrophy or shrunken brain that we see in the one side is sort of ignored in medicine, even though we see it all the time. It's ignored because people don't know what to do about it. They say, "Oh, we see that in alcoholism." We also see it in things like dementia. But in alcoholism, what we do know is if someone stops drinking, the brain can actually regrow. We have increased brain volume, more nerve cells can grow back, more nerve processes, and the brain can work better. And it actually is mostly the what we call white matter, or the connecting fibers in the brain that grow back, so that you're able to connect your thoughts that occur in different parts of the brain, your willpower, which we think of as coming from the frontal part of our brain, the executive function, can have more effect on our limbic system, or the emotional regulatory part of our brain that kind of drives our emotions and drives our addiction. So as the brain recovers and we get more of this connecting fibers, we get more brain matter, the brain works better. And it's very logical to imagine that the brain on the right-hand side is not able to pay attention to psychotherapy or counseling, or the admonitions of their friends. Hey, I cut back drinking, or you're drinking too much. Whereas someone with a less atrophied brain, without that destruction of the brain matter, they'll be able to say, yeah, I guess I'm drinking too much. I need to slow down. I need to switch from hard liquor to a beer, once in a while, or stop altogether. It allows them to have the freedom to do what they want to do. But once they lose that brain matter, it's harder and harder for them to be really free from the addictive processes.
Mm.
So that can be caused by a lack of omega-3. Very few people realize how important it is to really get a lot of omega-3 in our diets, and instead we have a lot of what they call omega-6. These are two different kinds of polyunsaturated fatty acids that we get in our diet. In America, we get lots of seed oils, which like soybean oil, peanut oil, safflower oil, corn oil. These oils have lots of omega-6, which tends to replace the omega-3 in a lot of places and cause inflammation. But without the omega-3 that you need for your brain, we get this atrophy. And of course, when we drink excessive amounts of alcohol, it's harder to take in nutrients, all nutrients, not just the omega-3s. So someone that's a heavy drinker will be depleted in B vitamins and zinc, calcium. Heavy drinking will also upset the microbiome, the normal bacteria and fungi and so forth that live inside of our intestines will be changed by this heavy dose of alcohol, and the brain responds to this change in our what we call microbiome, and as a result, we get more destruction of the brain. This destruction of the brain is partly due to what we call neuroinflammation, where the brain has a different milieu of a different environment of inflammation, sort of like any other inflammation in the rest of the body. But in the brain, we have a destruction of the brain tissue that continues until people stop drinking and start eating better.
Now, let me ask you this. You've shared with me before that if a person stops drinking after 6 weeks, their brain grows 2%. That's correct?
That's right. There's one research paper that really shows that on average, if someone stopped drinking 6 weeks later, the brain has regrown back in 2% in volume. It's a huge growth.
But how does that happen, though? I mean, here we are looking at the person on the right with it's a heavy drinker, and the brain is obviously diseased, damaged. So over time, and I want to drill down too on omega-3s after we get off the screen here in a minute. But over time, are you saying that brain on the right could it heal to the degree of the healthy brain on the left?
Well, we don't know how much it will heal, but we do know that it does. We do know now. We didn't know that 30 years ago that the brain really does grow back, and we do have increased brain growth that will, to some extent anyway, replace the damage. And the hope is that with continued sobriety, excellent diet, that the brain will recover. We don't know for sure how much, but we do know that people get better with eating well. And in my theory is that if people have been eating really well, a Mediterranean diet, a high omega-3 diet, a very low processed food diet, their brains are not as destroyed by the alcohol, and maybe they can control their drinking. Maybe that keeps them from going down the tubes and allows them to drink without drinking to excess. Maybe that's why, maybe some cultures, maybe the Mediterranean cultures are able to drink wine with their meals and they don't get as much alcohol problems as we do here in America, or maybe as they do in other places in the world. It may be because their brains are fed better with the diet, and the alcohol isn't as damaging to them. We just don't know for sure, but it seems like that's the case.
I don't want to get off track, but have you heard about these blue zones around all throughout Europe? And amazing, just amazing lifestyle, diet, exercise, and there is. I was watching this special, and they were, talking about, and these blue zones are for people that are living much longer than the average around the world, and really interesting. But diet, nutrition, let's drill down on this, diet, nutrition, and the brain, specifically omega-3s. And I want you to share, and again, we have a high regard for confidentiality here, and we'd never share names or, of anyone, but examples. We want to share examples, and I want you to share that example of one of your patients that was on you prescribed a high dose of, get on these omega-3s, and it just changed their life. Now, full disclosure, Dr. Umhau told me to, if I do anything, right, if I take anything in my life or in my diet, it's got to be cod liver oil. And ever since he told me that, I have, and researched it, I've been taking cod liver oil every day. High dosage of oh gosh, this has, oh my goodness, 1,060 milligrams in 1 teaspoon. And I take that every day. So let's talk. And it's, I don't know if I'm any smarter. I'll never be as smart as you. No, but I do feel so much better.
It does make,
but let's talk.
It does make you feel better, though.
Oh, it does.
Thing that I'm, my philosophy in medicine is first do no harm, right? So fish oil has been used as a medication for, since the ancient Greeks. 2,000 years of people have been talking about fish oil. Cod liver oil is one that's been around. They did research on cod liver oil hundreds of years ago, and it has benefits. And I've published a couple of articles talking about it, but it's there are other fish oils too. There's no data to show which one's best, but we do know that the omega-3s are really important for brain growth. I will mention too, the other thing that really helps the brain grow is stimulation of various kinds and exercise. Exercise is fabulous for brain growth. So some people, we haven't talked about this aspect of getting off alcohol, but some people find that exercise helps them get free of alcohol craving. That's how it works.
Yeah.
But the omega-3s are really interesting because they have such a profound effect sometimes. And I've had, we use medications to stop craving for alcohol, but I just love it when people can take the nutritional advice and they take cod liver oil at the old fashioned doses are a couple tablespoons a day. So that seems to be a reasonable thing for this supplement that's been around for a couple hundred years, and people feel better. I've had a number of people that have taken a little bit of fish oil every day, and then all of a sudden, try these higher doses, and they get better, and they just stop drinking. And it's wonderful to get people free, thinking clearly, and they find they're able to control their emotions. They don't get irritated. Don't feel as upset as easily by just having better brain function through the omega-3s. It's quite remarkable sometimes.
Yeah, you've shared over the years just the results that your patients have experienced. Now let's talk about alcoholrecoverymedicine.com, and let's really talk about addiction medicine and how that helps people be set free, and again, healing the brain. Now, I'm a big believer in desire versus disease, right? But the naltrexone and other medications I want you to really talk about just really reduces that desire to drink. And how does that work? And how can that help someone that's listening now that has never, for instance, Sinclair method, our dear friends Katie and Karen with Thrive Alcohol Recovery, really big proponents of the Sinclair method, naltrexone. So how are these medications, how do they work? And how, when combined with Christ-centered recovery, getting in those rooms, finding people that are safe, finding people that are that trust, surrendering to God and to, be set free. How does that combination work? But primarily with your experience, naltrexone addiction medicines, what have you seen and how have you seen results in those that you've been caring for?
Well, first off, I understand addiction is sort of a process that develops in the brain, and it's quicker for some people than others based on their genetics or their nutritional status and so forth. But it's a process that sort of short circuits a lot of normal processes in the brain, and people are driven to get what we call it the endorphins or the natural opiates that are these brain chemicals in our brain, and they drive us to do healthy things. Generally, they drive us to be with other people, to work together with others, to get sunlight, to get sweet foods that have lots of calories. These things are all driven by the natural opiates in the brain, the endorphins. And what we have is a process in the brain that gets short-circuited with drugs of abuse. A lot of drugs can affect this pathway. Opiates, of course, can, heroin and so forth. But alcohol also can induce the brain to release endorphins, these opiates, and people get addicted to that. And that process sometimes takes a long time to develop, but in anybody that drinks excessively, they're at a risk for developing this problem. When we use medications to interrupt this disorder, it allows people to get some space where they can develop other habits and decide, I don't really need the alcohol that much, and change their behavior. Sometimes that's the medications are all that people need. To be honest with you, they don't need to go to a counselor. They don't need anything else. Just taking the medicine will help them get free. Sometimes nutrition is all they need. Sometimes, going to church or having a counseling session, that's all they need. Mm-hmm. But a lot of times we have to address all these problems all together because we don't know what any particular person is going to respond to. But as far as the medicines we have now, in the last 20 years, we've really learned a lot about how medications can block the process of addiction, block the pleasure that people get from the drugs. And alcohol can be blocked in a number of medications. We have some that are FDA approved for that purpose, naltrexone, either a pill or an injection. We have a drug called acamprosate, which helps people stay off alcohol particularly well, so they don't get the craving for alcohol that can increase day after day. When people stop drinking, oftentimes they'll want to drink more and more and more as time goes on. It's called the alcohol deprivation effect that Dr. Sinclair realized occurred in animals. It also occurs in people, and that really is a problem. So people have a bad experience drinking. They say, I'm never going to drink again. But then they find that they are drawn to drinking more and more as time goes on. And that is an addictive process in the brain that can be blocked by, for instance, naltrexone. Other medicines include topiramate, which is off-label. Baclofen sometimes works. Ondansetron sometimes works. So there's a lot of medications that we find can help people. And again, because everybody's so different, different medications work better for others. But the one that seems to work most of the time for most people is naltrexone. And it's a wonderful tool that we have now in the last 20 years. It's not addicting. It's fairly safe medication. It specifically blocks opiates in the brain. It's the same family of medications as naloxone that we use to wake up somebody who has an opiate overdose.
But doesn't naltrexone work also for people that struggle with opioids and even pornography?
Right, it does. It interrupts the reinforcement that people get in their brains from a release of endorphins or opiates. Okay. So when you're doing certain behaviors, whether it's marching in step with your soldier comrades, or dancing in synchrony with a partner, or donating money, or helping other people, we get natural endorphins, and that drives us to do those healthy behaviors. And when we're sitting alone in the basement, we don't get them, and so it's much more attractive to ourselves to have a drink of alcohol, which gives us endorphins that we would be missing otherwise. And that part of the problem of the pandemic is people were isolated; they didn't get to be with families, and normal sources of endorphins are with people, and with that personal exposure. Alcohol is so much more pleasurable. That may be one reason why groups for alcohol problems are so successful, because people feel
absolutely
connected, and that gives them endorphins in a healthy way.
Well, I've seen it for 27 years, and that's why I wrote my book. When you mentioned that, when COVID, appeared on the scene, it allowed me to slow down. And I was inspired by the Lord to write the book. And the title of the book was just that: Stop Hiding, Start Healing. Because I've observed hundreds of people over the last over 2 decades that continue to go to church to hide, rather go to church to heal. And these are people dealing with all kinds of major life issues. But our tendency is to hide. I mean, go back to Genesis chapter 3. I mean, that's exactly what they did. Once sin entered in, shame appeared, pain appeared, separation from God appeared, and they hid from God. And it's been going on ever since, it really has. But I've observed so many people that have come out of isolation, enter into a Christ-centered environment where it's safe and trusted. And I've been in those circles. I've sat with so many different men's groups and seen miracles happen in their lives. And it's true. Like you mentioned, if you're in the basement all by yourself, isolated, that's your choice. And it's natural if you are feeling shame, pain, guilt, abandonment, betrayal. There are all kinds of different reasons, as we've talked about, why people drink, why people use things to escape.
Yeah, shame is one of those powerful emotions that humans can experience. It's extremely powerful in shaping our behavior. It certainly accompanies many people's struggle with alcohol because they're so ashamed of their failure to do what they want to do. People don't want to be drunk, and they don't want to act.
It's debilitating.
And the shame that they get from that can be overwhelming.
Yeah, I read a study. I'm sorry, I can't. I forget exactly where. I shared it at the seminar we had in November, but where pain and shame, when one feels shame, it triggers the same part of the brain that produces pain. It was a very, very interesting, and it's overlooked often, that when people are feeling shame, boom, immediately, the same area of the brain triggers pain, which is just from my own experience, but also what I've observed in so many different people, is why they choose something to medicate that instead of going straight to the one that can heal. And that's the Lord, who can heal, restore, and free you of your shame. It's a promise. He's the one that can, but it's amazing, that combination, though. I thought that was amazing, that the same area of the brain targets pain when one feels shame.
And it's the pain and the shame that make alcohol or other drugs even more pleasurable, even more important.
Yeah.
The natural thing when we're in grief is to surround ourselves by our friends and loved ones. If we don't have that, how are we going to deal with the pain? Well, people go to these unhealthy ways of dealing with pain.
Exactly. Yeah. Well, let's talk about, as we got a few more minutes here, and I so appreciate your taking the time. I really am. But let's talk about those that are in the audience that are struggling and really could benefit by reaching out to you through alcoholrecoverymedicine.com. In closing, share, with anybody that may be struggling out there and invite them in.
So if you're struggling with alcohol, or you know somebody that's struggling with alcohol, there is really hope for you. It's very different than it was 30 years ago. We know that nutrition is critical and makes a huge difference. We know these medications can block this terrible craving that people have. And once you get craving, it's not your fault that you're craving alcohol. You shouldn't be ashamed of that. That's the disease. And you can overcome that in lots of ways. Exercise, by surrounding yourself with friends and family that love you. And you can also overcome it with naltrexone and all these other medications used in a specific way to block the craving for alcohol. It helps you get free. There is really good news. And what's the important thing that I would encourage everybody that hears this podcast is to share that good news with their friends who may think that, alcoholism is just a character defect or just someone's choice. Well, after a while, the choice kind of goes away and they're addicted, and that can be helped. And by just going into a place and doing talk therapy, that may not be sufficient. As we looked at those brains, it's hard to imagine that the brain of someone who has atrophied from alcohol is going to be able to respond to common sense or reason.
Exactly.
They need more than that. They need nutrition. They need these medications to help them get free. And we need to recognize that and not just shame people into making them feel even worse that they can't stop drinking.
Oh, no, absolutely not. And that does happen in certain circles, people feel absolutely horrible about themselves already. And the last thing they need is others to condemn them or shame them, and our role, my role, and your role and others that we associate with is to speak life into people. There is hope. There is encouragement. You can be set free from this. I've seen thousands of others that have been set free. And with the help of medication and whether it's counseling, even some rehabs might be. I've known stories of people that have gone to rehab after rehab, and they finally get to the place, and you said it earlier, it's different for everybody. There is no blueprint it is different. We all have, different fingerprints. My story may be similar. Others, we may have a common denominator there, but at the same time, your path, your mission, your destiny, your purpose is yours. It's their own. And the hope and the prayer is that you would choose to get to the place where the pain is greater than your fear, reach out and start the process of healing. And that's what I hope people will do that are listening, John, that will come to your website, alcoholrecoverymedicine.com, alcoholrecoverymedicine.com, and reach out to my dear friend, Dr. John Umhau, and he will take care of you. I know for a fact, has a heart for people and a passion to see people be set free. Brother, thank you so much for being with me today. I really appreciate you taking the time.
Thanks, Greg. I really appreciate being here.
Okay, brother. I'll be talking to you soon, I'm sure.
Okay.
Thank you for tuning in to another episode of Stop Hiding, Start Healing. We hope our time together has ignited a spark of self-discovery and inspired you to take bold steps towards healing and growth through Christ-centered recovery. Remember, the journey is ongoing, and every choice you make to confront your challenges and embrace your true self brings you closer to a life of meaning and purpose. If you enjoyed this episode, don't hesitate to share it with others who might find encouragement and strength in our discussions. Be sure to get a copy of Craig's book, Stop Hiding, Start Healing, available on Amazon and where books are sold. And visit our website, stophiding.starthealing.org for more information and to invite Craig to speak at your next event, seminar, retreat, or conference. Be sure to join us next time. And remember, it's time for you to stop hiding and start healing.